Good afternoon. I'm Dr. David Ferriss, a physician at MaxWell Clinic, and I have with me Jeremy Paluch, who is a clinical colleague and one of our nurse practitioners at MaxWell Clinic. Welcome to our webinar this afternoon on near-infrared light therapy. The title of it is Shining a Light on Brain Health, which we're going to try to give you an idea of what that's about, what some of the research involves, and how we're applying that here in patient care at MaxWell Clinic. So with that, let's jump in. We'll take no more than 30 minutes to talk, and then we'll open it up for any questions that you have. You can submit those questions from your screen, and we'll answer as many of those as we have time for before we conclude. So, what is what we call and refer to tPBM? The little t stands for transcranial, and the PBM stands for photobiomodulation. It's a bit of a mouthful till you say it a few times, but as the definition that you see here states, transcranial photomodulation is a form of light therapy that involves the application of near infrared or red light to the head with the intention of stimulating mitochondrial activity in brain cells. The mechanism relies on the ability of certain wavelengths of light, in this case, wavelengths that are part of the near-infrared spectrum of light, to penetrate the skin and skull, reaching the brain, where it can exert its effects on neurons and other brain cells. I think a lot of people express surprise when they learn that you can actually apply near-infrared light to the scalp and the skull and learn that it can penetrate those organs and go as deep as 3 to 5 centimeters or about 2 inches into the cerebral cortex of the brain. So it can be very powerful, and it has a growing number of applications. We're going to concentrate today on applications of near-infrared light therapy on the brain. So I want to take just a minute to talk about how does photobiomodulation work. There are a number of effects that it has that have been learned through a growing body of research. But the three big ones to remember are that it reduces inflammation in the cells of the brain. It increases circulation. Primarily here, it's near-infrared light therapy causes an increase in nitric oxide in the brain, which is a potent vasodilator, and that increases circulation in the brain. And it also activates the mitochondria of the cells. You may recall that mitochondria are the organelles of the cells that provide energy to all cells. So photobiomodulation increases cellular energy, and it does a lot of other things as well, but these are the big three that have the primary effect and are the reasons why so many different conditions respond to photobiomodulation. So we're going to take a few minutes just to give you a sense of some of the major areas where extensive research has been done. This is still very much a developing body of work. There's a lot of the early studies for all of the 10 areas that you see displayed on this slide, which Neuronic, the manufacturer of the particular helmet that we use and that Jeremy will explain to you shortly, they've allowed me to use this slide. But I want to walk you through just to give you some sense of the research that is growing by leaps and bounds in this area of photobiomodulation therapy. So starting with Alzheimer's. Alzheimer's is a huge and growing problem in this country and in other countries. It's extremely debilitating and exerts a high toll economically and on the quality of life of individuals and their caregivers. Photobiomodulation has shown a lot of promising potential for treatment of Alzheimer's, and this is based on quite a large number of animal and human studies. For a lot of the measures related to Alzheimer's, you need to be able to have an animal model so that you can examine the brains, mostly mice have been used, before and after therapy to see what impact did it have on of what's going on in the brain. But just to give you a flavor, a recent systematic review of 35 different published studies showed that 83% of the studies that were reviewed reported positive improvement in cognitive functioning after PBM therapy. Only about half of these studies were what we call randomized clinical trials, which are something of the gold standard of these types of interventions, whether it's a drug or it's a therapy such as photobiomodulation. But the other studies that have been done have to do with case studies or studies in which there is not a formal comparison group, but careful measurements are made before and after the intervention in this case, photobiomodulation. PBM, which is the acronym that we use for photobiomodulation, appears also to reduce the levels of amyloid beta proteins in the brain, one of the key characteristics of Alzheimer's disease, and stimulates autophagy in brain cells. This is the natural process of cell death that occurs in the body as cells age and need to be replaced. It reduces inflammation and it increases level of an important factor called brain-derived neurotrophic factor, or BDNF, which stimulates improved neural function, that is the connection of neurons with each other, and promotes neurogenesis, the creation of new neurons in the brain. So a lot of encouraging research coming out of the Alzheimer's area, and I think we'll see more and more evidence, particularly as large randomized clinical trials can be completed. Long COVID, I think everyone has heard of with the advent of the COVID virus 4 years ago. I know we at MaxWell Clinic have seen quite a number of patients the last few years that have developed what we call long-haul COVID. These are individuals that have the infection, or in some cases, they were vaccinated, and as a result of the vaccine, they appear to develop some long-term symptoms. And one of the primary symptoms is brain fog. A lot of difficulty functioning cognitively, struggling to focus and concentrate. And PBM has, in a growing body of research using PBM to treat symptoms of long-haul COVID, has been very successful. It's shown beneficial results. One study of 20 long-haul COVID patients who received PBM and compared them to 20 long-haul COVID patients who did not receive PBM demonstrated that the patients that received the photobiomodulation therapy significantly improved their cognitive function as measured by a test that we call the MoCA, the Montreal Cognitive Assessment. This is a test that we use frequently here at MaxWell Clinic that provides us a good overall sense of the degree, if any, of dementia, particularly in Alzheimer's. And then a 2023 study involving 14 patients with long-haul COVID symptoms who were assigned randomly to a PBM treatment or a whole body near-infrared treatment where they were exposed to near-infrared light, not just on their head, but in their whole body, demonstrated that both of these means of therapy were effective. And they were able to demonstrate significant improvement in both groups in the subject's cognition, their executive function, the processing speeds of their brains, and their self-reported level of improvement. Parkinson's disease is another common neurodegenerative disease of the brain. And PBM has been shown to be a promising treatment for it as well. A small randomized clinical trial demonstrated gait improvement. Abnormalities of gait and balance is very common in Parkinson's as it progresses. And they demonstrated gait improvement after a 9-minute PBM session twice weekly for just 9 weeks. So that study was encouraging. Another small randomized clinical trial demonstrated improvement not only in gait, but in fine motor skills and cognition after 12 weeks. And very importantly, the patients did not show evidence of regression for up to 1 year with continued at-home PBM therapy. There's also some evidence that photobiomodulation appears to delay further neurodegeneration. So in a sense, it's encouraging that photobiomodulation may help slow down or arrest the progression of Parkinson's. We don't have evidence sufficient to say conclusively that that is case, but some of the studies that have been done are encouraging that may be in fact true. Autism is another area where some encouraging results have been obtained for individuals that are somewhere on the autism spectrum. In one non-randomized clinical study of 40 participants between the ages of 5 and 17, all on the autistic spectrum, these individuals received 8 5-minute near-infrared light treatments over a 4-week period. So 2 treatments a week for 4 weeks. And at the end of that time, they saw a statistically significant decrease in irritability, lethargy / social withdrawal, hyperactivity, and inappropriate speech. Several clinical reports of PM, so these were individual case studies in individuals with autistic spectrum, demonstrated improvement in a range of behavioral measures, which are common to individuals on the autistic spectrum. And this included their social awareness, communication and motivation, and a reduction in restricted and repetitive behaviors that can be common with individuals with autism. General wellness, not to leave out individuals who don't have a diagnosis of some type of neurological problem, but multiple studies have demonstrated that healthy adults can benefit from ongoing photobiomodulation, which includes improvements in their cognitive function. They haven't reached a state where they really have any significant dementia. They're still highly functioning, but they may, as they get older, have a few memory lapses, things that are very common, have what are often referred to as senior moments. And PBM has been shown to reduce inflammation, enhance mood, improve sleep, and improve memory in a number of these individuals. ADHD, very common diagnosis that we see at the MaxWell Clinic. Number of studies have demonstrated a reduction in symptoms of ADHD following PBM therapy. These symptoms include an improvement in adults' capacity to concentrate, plan, and control symptoms of ADHD. And one of the things that photomodulation does is it seems to increase neuroplasticity of the brain, the ability of the brain to be receptive and to train more easily, to change. And so we have begun using this on a selected basis, preceding neurofeedback sessions, which we have long used as an effective therapy for many individuals with ADHD, by preceding their neurofeedback session with a 6 to 10 minutes of photobiomodulation. So we don't have enough data to know whether that's going to improve, but we think there's good reason of why that may increase the effectiveness of neurofeedback. PTSD, we see a lot of as well. Post-traumatic stress disorder, a randomized clinical trial involving photobiomodulation and PTSD in 2021 compared a treatment group. The individuals received photobiomodulation therapy, and they were compared to a group that received what we call a sham therapy. To the patient, it looks exactly like they are getting the photobiomodulation. They use a helmet. They're exposed to near-infrared light therapy for the same length of time and the same frequency as those who are actually getting the treatment. And at the end of the study, different measurements that were established at baseline are compared afterwards to see whether there has been improvement. And in this randomized clinical trial in 2021 involving the sham treatment group, a significant decrease in PTSD symptoms was observed at 1 week and at 1 month of therapy. Another study with PTSD involved 11 individuals with traumatic brain injury, ages 26 to 62. They received 18 sessions, or 3 sessions per week for 6 weeks. And in these individuals, the researchers were able to demonstrate significant improvement in executive function and verbal learning and memory. So again, another area, PTSD, in which near-infrared light therapy may be helpful. Traumatic brain injury, another area related to PTSD. A lot of encouraging work here. A lot of animal studies have been done with mice with TBI, and in those studies, the researchers observed improvement in neurological function, reduction in size of brain lesions, decreased neuroinflammation, an increase in brain-derived neurotropic factor, which stimulates the formation of new neurons in the before and the after treatment of these mice. There are multiple case studies of using PBM for treatment of concussions with very positive results. Again, what PBM has demonstrated in brain injury victims is an ability to decrease inflammation, stimulate neurogenesis, that is the production of new neurons, improve mitochondrial function, and to decrease oxidative stress. And then finally and quickly, with depression and anxiety, 2 very common mood disorders that we see lots of. With depression, Photobiomodulation appears to be a promising treatment for depression. What we don't have yet are large randomized clinical trials. Those are very much needed and hopefully will be done in the next few years. But multiple studies do provide strong evidence this time for photobiomodulation's increasing mitochondrial energy production and increasing regional blood flow that we talked about earlier. And this certainly seems to have a very positive effect in reducing symptoms of depression. And then finally, with anxiety, photobiomodulation appears here to be a promising treatment for anxiety. But again, like depression, we really need some large randomized clinical trials to be able to say that conclusively. And to wrap up, with respect to anxiety, there was a non-randomized clinical trial study involving 15 individuals with generalized anxiety disorder, ages 18 to 70. They received photobiomodulation therapy for 20 minutes for 8 weeks each day. And the researchers observed decreased anxiety and improved sleep using a number of valid assessments before and after treatment. And then finally, another non-randomized clinical trial study involving 10 individuals with generalized anxiety disorder. These individuals received a single 8-minute photobiomodulation treatment. And just that one treatment in these 10 individuals resulted in decreased anxiety and depression at 2 weeks and 4 weeks after that single treatment, which is pretty amazing. So hopefully, as these non-randomized, as we have more randomized clinical trials in all of these 10 areas of research involving photobiomodulation, we'll be able to draw stronger and stronger conclusions as to the efficacy of this technology in the treatment of these disorders. So with that, I'm going to get rid of these slides and turn it over to Jeremy to tell you a bit about the specific therapy that we are using at MaxWell Clinic, a little bit about that and how it works and how easy it is to use. So, Jeremy?
So I'm acting as Dr. Ferriss' sidekick today. Did all the heavy lifting, kind of analyzing all those all that data for us. But just to add on a little bit, here's the helmet here, and we'll kind of dive into this here in a second. This is actually pretty simple, and it has a lot of potential. This is a pretty natural therapy because 1070 nanometer light, that's just, you're getting that from sun exposure. And this is able to penetrate into your brain, like he said, actually give energy to your cells, and has potential to stimulate the growth of new neurons. So I think that's pretty cool. So we have typically a very multifaceted approach at MaxWell Care, but this is a really easy add-on. So as you can see here, the title there, Neuronic, Neuro Radiant 1070. And there is 256 LED lights on the inside. Now, 1070 is above the spectrum that you can actually see. So you don't actually see that frequency. It is plugged in here into a unit that I'll get to here in a second. And it's quite simple. Put it on your head. And then you'll have the screen here, which I don't know if you can see that very well, but there is several different settings. There's peace, focus, energize, and glow. Those are the preset settings. Glow is a pretty common one. That's one that we use during the day. It is really pretty broad spectrum. It's good for a majority of the, it's good for pretty much everything, actually. You won't want to use it after sun sets because it could potentially interfere with sleep. And I don't know if you mentioned that. That's really maybe the only side effect is if you use some of these before sleep,
Right.
It could keep you awake.
That, or if what they found is if you do too much, there is such a thing as too much of a good thing. And so that's why most of these protocols that come standard with the Neuronic technology, we're talking about a maximum of 10 minutes. Some of the modules are only 3 or 4 minutes, depending on the pulse rate and the intensity of the near infrared light. But yeah, it's easy to use. As Jeremy says, you put on the helmet and then you hit start.
Yeah, and I am going to go ahead and do the energize just to make sure we can get through the rest of this webinar. And this is a short 3-minute one. And some of them, yeah, like you mentioned, the glow setting is 10 minutes, the peace setting is 9. So, and it's just that simple. You leave it on your head.
Yep. I've noticed in my own experience with this technology that sometimes I'll feel just a slight warmth from the helmet by the end of the session, but really that it's just important to follow your clinician's instructions on the use of one or more of these different modules. They do differ in how the intensity and what we call the pulse rate, as well as the time that they're administered in a particular module. But yeah, it's super simple to use.
Yeah, and it runs through its time and then it stops automatically. If you needed to stop in there, there is a button there. You can just press stop, but this box plugs into the wall and this box plugs into the helmet. Pretty straightforward.
So, ways that we've been using this technology the last year or so, as I mentioned previously, in conjunction with selective neurofeedback patients as a precursor to their neurofeedback session. And we believe there's a likelihood that this will help increase the neuroplasticity of the brain through the near-infrared light session, and perhaps make it the brain more amenable to the training that it gets with the neurofeedback. And so we're hopeful that perhaps over time we'll be able to see that those patients may progress more quickly than they would without that. I know a number of our clinicians with a number of patients with Alzheimer's disease or other forms of dementia, in combination with other therapies, are using the helmet, having patients use the helmet on a daily basis at home. That's the nice thing about this. It can be used at home very safely. And we're eager to see whether that seems to help to perhaps slow down the progression of some of these neurodegenerative conditions, or whether, and there's the beep.
That's the alarm. That was it.
Jeremy's completed 3 minutes using the Energize module. And it's really that simple to use. One thing you do have to be careful about is not overdoing it. It's not recommended that you do more than 2 sessions per day. Sometimes some individuals, it's been found, are more sensitive to the effects of near infrared light than others. And you can get something called overstimulation, and in which case you simply back off the therapy or not do the therapy for a couple of days and then dial it back in terms of time or intensity until that individual accommodates to that. Jeremy, anything else you want to add about this new technology?
No, I think that's pretty much it. I like the simplicity of it. I like the applications that we have for it. It's again, an excellent addition to other therapies, and really nice that you can take it home and just use it at your leisure at home.
Um, it is important to realize, particularly with all of the neurologically related conditions that I gave an overview of with respect to some of the research, that this is typically just one piece of a total program of therapy. At MaxWell Clinic, we always start with lifestyle. If you've been a patient here, you know how important diet is, eating a healthy diet, giving the body the nutrients that it needs, and how important regular physical activity is. Those are always important. Um, we also know, and many of you will be aware of the strong gut-brain connection. If you don't have a healthy gut, you're not going to have a healthy brain. And that has been well demonstrated in a large body of published research over an extended period of time. So I don't want anyone leaving this webinar to think this is a magic bullet. Those typically don't exist in medicine, but it is a very promising technology. And that's why, as we've gained some experience with this and continue to gain more, we wanted to devote a webinar to exposing you to this. If you're interested in finding out more whether this might be an appropriate therapeutic methodology that should be included in your total plan of treatment at MaxWell Clinic, then discuss this with your individual clinician. With that, if you don't have anything else, Jeremy, we'll stop and we'll look and see if there are any questions.
Yeah, the last thing I'll say is I couldn't agree more with Dr. Ferriss. Like right now, I kind of think of this as a supplement, kind of like diet with, diet is going to be the most important, exercise and things like that are important, but we do recommend supplements at times because they can enhance things. And I think that's kind of how I'm looking at it right now is data looks promising, but I think of it as another add-on to support what we're already doing.
Yeah, exactly. A really important point. One question is, has any research been done for mental health issues such as bipolar and or schizophrenia? A great question. I have not come across any studies specifically related to either bipolar depression or schizophrenia. So the simple answer is I'm not aware of any. That doesn't mean that it doesn't exist, but it is not something that has shown up yet in the research that I've been done. I've done thus far. So it's possible that it might have some benefits, but I'm not aware of any research to date that has looked at those two conditions. There's another question. Should I buy my own helmet or go to your clinic to use your helmet? Most of the individuals that we're seeing at MaxWell Clinic, if we think this is an appropriate methodology that might be of potential benefit to you as a patient, as part of your total treatment plan, then we'll discuss that with patients, and we're increasingly, where we see opportunity, telling them about this technology and suggesting they may want to try it. Some individuals may wish to rent a helmet for a month and just try it, and then they and their clinician together can decide, does this seem to be beneficial? In which case, and they want to do it long term, then they may want to consider buying one, and they can be purchased as well, and we can handle that for the patient to make that simple. I will mention one thing. We mentioned the these four standard modules or programs that are part of the Neuronic helmet technology and that have wide versatility. There's also a custom program option, and that can even be customized for a patient based on one's individual electroencephalogram tracings. So in those cases where it might be optimal to customize it specifically for a given individual based on their EEG findings, then our neurofeedback department can do typically their 10-minute recordings with eyes open and eyes closed using a helmet with 19 electrodes. And then that data can be sent to a clinical consultant at Neuronic who will customize those settings for someone who wishes to purchase a helmet and use it using that mode. There's another question of, could this be helpful for Lyme disease? Or if you're stuck in fight or flight mode. I have not seen anything specific in the research to date regarding photobiomodulation and its use with rickettsial diseases, with tick-borne diseases such as Lyme. But possibly in time, there may be, since that does have neurological effects in chronic Lyme, then that's possible. But I'm not aware of anything at this time. Are you?
I'm not either. I don't know if there is any, but I mean, we could speculate, and I don't want to do that too much speculating on this, but depression, anxiety, brain fog, all can be pretty common in Lyme disease, and those are all applications.
Yeah.
It certainly wouldn't be the only treatment, of course, for Lyme disease, but as an add-on, potentially, that's all I can really say, right?
Yeah, yeah. So, and then the second part of that question's, or if you're stuck in fight or flight mode, these have to do with, autonomic nervous system issues of too much sympathetic activation for someone who's in fight or flight. There's certainly, a number of therapies that can be applied there. Including lifestyle, regular exercise can be really helpful, a healthy diet, and also neurofeedback sometimes can be very helpful there. I would venture to suggest that perhaps it could be helpful as one piece of a total treatment plan, probably not as a sole treatment for that. Again, I haven't seen research specific to that, but this is still very much an evolving area of research. But one, if you look at the curve in terms of number of published studies related to photobiomodulation and its application to clinical problems, it's looking more and more like a logarithmic curve, where the number of published studies each year keeps going up more and more. We've got one more question. How long do you think you would need to use photobiomodulation therapy before you see any results, days or weeks? Well, as I tried to point out with some of the studies that I referenced, different studies have looked at treatment protocols that were, one was a single treatment on one day, and they saw some benefit. I would say for most conditions, we're probably looking at weeks or longer to see benefit. But most of the studies across a number of conditions, there seemed to be improvement. Most of the studies were not long-term studies. They involved 2 to 4 weeks. And in most cases, they saw benefit. So I don't think it's the sort of thing where you would necessarily have to do this for months. or years, although with neurodegenerative conditions such as Alzheimer's, such as Parkinson's, if this turns out to be a therapy that can be demonstrated to conclusively be of benefit to these individuals, and there's good reason to think that this will turn out to be the case as we have larger and more randomized clinical trials that demonstrate improvement in these conditions, that these patients would probably want to use this technology over, indefinite or long-term therapy to try to prevent progression of those diseases. So I think there's a lot to be encouraged about there. That's all the questions that we have. So thank you for joining us today. I hope this has been at least a high-level introduction to photobiomodulation and some of its benefits. And if you are a MaxWell Care patient and you're interested or think this might be of benefit to you, feel free to bring it up the next time you have an office visit with one of our clinicians, and they'll be happy to discuss that with you and see whether it might be a useful addition to your total treatment plan. So with that, we'll close. And thank you for your attention, and look forward to seeing you again in a future webinar in the future. Take care.